Hello and welcome to Medicare 101, the basics presented by Paradise One Insurance. My name is Kevin and I'll be here with you for the duration. Some of the things we're going to cover during this presentation are Medicare Part A, Medicare Part B, avoiding the 3 Medicare penalties, when and how to enroll, how to lower your drug costs. We're going to go over dental, vision, and hearing. We're going to go over prescription drug options, Medicare supplement plans, Medicare Advantage plans, and the differences between them. We're going to compare your Medicare options. We're going to talk about Medicare Extra Help and if you should enroll at age 65. That's me. I've been helping people with Medicare since 2020. I've literally helped thousands of people make informed decisions about their Medicare. I am a Marine Corps veteran, spent over 20 years in the retail and hospitality sector, and I'm a father of 2 amazing young ladies, Emma and Grace. So there is a legal disclaimer here. I can only talk about certain things. I cannot get into any specifics, such as private insurance companies or the prices. I can also not talk about specific benefits and specific plans. This is an educational only presentation, so I cannot get into any sales related material. So why are you confused? You're probably getting a ton of calls every day, a lot of information in the mail, you're seeing TV ads, and it's probably the first time you've really had any kind of ability to make a choice about your health care outside of what you were offered while you're in the workforce. So hopefully I can help with any confusion and answer any questions you might have. So we're going to talk about some common mistakes people make when enrolling in Medicare. The number one mistake there is it's not a one size fits all for everyone. Just because your neighbor or family member has one plan that works great for them doesn't mean it's going to work great for you. Everybody has their specific needs, and it's imperative to do a needs analysis before you enroll into a plan. Medicare is definitely unique. Each plan is definitely unique to each individual. So let's go over some key terms you will see in Medicare. So let's talk about deductibles. What is a deductible? A specific amount of money the insured must pay before an insurance company will pay the claim. If you have $1,000 deductible and the overall bill is $5,000, then you're responsible for the first $1,000 and the insurance company is going to pay the $4,000 after that. Coinsurance. Coinsurance is a type of insurance which the insured pays a share of the payment made against the claim. If you have a 20% coinsurance and the overall bill is $100, then you would pay $20, which is 20%. The insurance company is then going to cover the remaining 80%. Now, co-payments. Co-payment is payment made by the beneficiary in addition to the payment made by the insurer. Co-payments are very popular in most insurance plans. So if you have a $20 copay for a doctor, every time you visit that doctor, you're going to pay that $20 copay. So deductibles, coinsurance, and co-payment are very common in most Medicare plans. So don't be surprised to see all 3 of those in a plan that you choose. So what is Medicare? Medicare is a federal government health insurance program. For most people over the age of 65, Medicare becomes your primary health insurance. So who administers Medicare? Medicare is administered by the Centers for Medicare and Medicaid Services, commonly referred to as CMS. CMS is an agency within the Department of Health and Human Services. So what is Original Medicare? Original Medicare is actually Part A, which is considered hospital insurance, and Part B, medical insurance. You'll hear a lot of other things about Medicare Part C and Medicare Part D. We'll get into those here in a little bit, but Original Medicare is considered Medicare Part A, hospital, and Medicare Part B, medical insurance. Now let's go over some key things that is not covered by Medicare Part A and Part B. So any cosmetic surgeries, acupuncture, hearing aids and exams, routine foot care, long-term care, most dental care, and eye exams related to prescribing glasses are not covered by Medicare Part A and Part B. All right, so let's go over Medicare Part A, hospital coverage in detail. So what does Medicare Part A cover? Medicare Part A covers inpatient care in a hospital, skilled nursing facility care, home health care, and hospice care. So let's talk Medicare Part A premiums. If you've worked 40 quarters, you have no premium. 30 to 39 quarters, your premium will be $311 per month. And if you've worked less than 30 quarters, $565 per month. All right, let's talk about Part A deductibles and coinsurances. We're going to get to the nitty gritty here of Medicare Part A. So reach benefit period in 2026, days 1 through 60 of inpatient hospital stays. So if you're in the hospital for up to 60 days, your deductible is going to be $1,736. Now, there is a coinsurance for days 61 through 90 of $434 per day. And then days 91 through 150, the coinsurance goes up to $868 per day. If you're in the hospital over 150 days, then you are responsible for 100% of the cost. Now let's talk about Medicare Part A skilled nursing facility costs, okay? So days 1 through 20, no copayment. Days 21 through 100, $217 per day. And then all days over 101, you will be responsible for 100% of the cost. Part A, late enrollment penalty. Your premium may go up 10% if you do not sign up for Part A when you are supposed to. You will have to pay that penalty for twice the number of years that you did not sign up. All right, now we're going to go over Medicare Part B in detail. So what does Medicare Part B cover? It covers medically necessary services, preventable services, durable medical equipment, ambulance rides, and some medications. So let's talk about Medicare Part B premiums. This can be very confusing to some people. What Medicare does is they do a 2-year look back on your income to determine your current year premiums. So for 2026, they're going to look at your income for 2024. So study the chart below. Take a look at where you fall in there. It is not uncommon for people right after they retire to pay a higher Part B premium. And as they get into retirement and their income lessens, they fall into a lower bracket and their Part B premium actually comes down. Take a look. If you have any questions, leave it in the comments and I'll definitely get back to you. But it's pretty self-explanatory. So let's talk Medicare Part B deductibles and coinsurance. The deductible for Medicare Part B in 2026 is $283. And the coinsurance is Medicare will pay 80%, you will pay 20%. So if you stay on original Medicare and you go to the doctor and the bill is $100, we'll do easy math here. Your bill's $100, Medicare is going to pay 80 of it, and you will be responsible for that $20. So Part B excess charges. All right, Medicare has assigned rates for medical care. Doctors can charge 15% more than the Medicare assigned rate, and that excess charge falls on your shoulder, so you would have to pay that extra 15%. Not a lot of doctors do it, as far as I know, but there are some out there that do charge that extra 15%, so that's something to be aware of. You can typically ask your doctor's office if they charge the excess charge, and they'll let you know up front, so it's not a surprise. So paying your Part B premium. How do you pay for it? Well, if you're already on Social Security, your Part B premium will be withheld from your Social Security check. If you're not on Social Security, then you will get a quarterly bill from Medicare to pay for your Part B premium. So let's talk Medicare Part B late enrollment penalty. So your monthly premium may go up by 10% for each 12-month period you could have had Part B but did not sign up. So if you go 2 years without it, you could be paying a 20% penalty. This is a lifetime penalty, unlike your Part A penalty, which is just double the amount of years that you did not go without it. All right, now we're going to talk about prescription drug coverage in detail. All right, so Medicare Part D, or prescription drug coverage. So there's 3 stages to it. You have your deductible stage, your initial coverage stage, and catastrophic stage. Now, in your annual deductible stage, depending on your drug plan, they can set the deductible from $0 to the Medicare max of $615. So let's say it's $615 deductible. You will pay 100% of the drug costs until you hit that deductible. Some plans have deductibles and some do not. So that's why it's important to shop around and see which plan is best for you. Now, once you get to step 2, which is the initial coverage, it's $615 to $2,099. You will pay copays and or coinsurance according to your drug plan. You stay in that stage until you hit a combined total spend of $2,100. Once you hit $2,100, you are covered 100% for any drugs in your formulary. The prescription drug plan and Medicare will cover all costs above and beyond $2,100. Tiers within prescription drug plans. So the costs of medications are based on tiers as determined by the insurance companies. Most plans have 5 tiers. The lower the tier, the lower the price. So tier 1 will have the lowest cost. Tier 5 will have the highest cost. Always make sure your medications are covered by the insurance company. It's not a given that all medications are covered. Some name brand drugs are not covered, but their generics are. So when shopping for a drug plan, it is imperative, very important, that you put in all your drug information to the plan to make sure that it's covered and the costs associated with it. If you're on the phone with an agent and they want to skip this step, get off the phone. They don't have your best interest in mind. So just like with Medicare Part B, there may be an income-related monthly adjustment, also referred to as an IRMA, based on your income. So in 2024, remember they do a 2-year look back. So they're going to be looking at your income from 2024 to determine if you have to pay anything above and beyond your monthly plan premium. So look at the chart below, see where you fall in, and you'll see if you have to pay an additional fee to Medicare based on your yearly income in 2024. All right, Part D, drug plan penalties. So you may have a penalty for not enrolling in a drug plan when you're eligible. This penalty is permanent, and it is a lifetime penalty like the Part B penalty. All right, drug plans can and do change. So formularies change from year to year. It is strongly recommended that you get your drug plan quoted every year during the annual enrollment period, which is from October 15th to December 7th. You want to make sure that A, there aren't any better plans out there, B, that you can't save some money by switching plans, and C, you want to make sure that any new drugs that you have will be covered in the coming year. So there are 2 ways to get Medicare drug coverage. The first one is to enroll in a standalone Medicare Part D prescription drug plan. The second way is to enroll in a Medicare Advantage plan that includes prescription drug coverage. All right, so let's recap Medicare penalties if you don't have credible coverage. So remember, Medicare Part A, which is hospital coverage, is twice the number of years. So if you go 2 years without Medicare Part A, you'll be responsible for paying a penalty for up to 4 years. Medicare Part B is a lifetime penalty, and Medicare Part D, your drug plan, is also a lifetime penalty. Now, we're going to talk a little bit more about credible coverage later on, so make sure you pay attention to that because you may not have to sign up for Medicare at 65, and you can avoid the penalties if you do have credible coverage. So how to pay the gaps created in Medicare. So a lot of people have that question. How do I pay for those gaps associated with original Medicare? We're going to talk about that. So there are 2 main ways to help pay the gaps. The first one is a Medicare supplement plan, and the second is Medicare Advantage. First, let's talk about Medicare supplement plans in detail. All right, some key points for Medicare supplement plans. They are offered by private insurance companies. They have a lot of flexibility. They travel well. So if you travel a lot, or if you're a snowbird, if you spend most of your time up north and like to travel to the south, like Florida, during the winter, these are great plans for that. And they are accepted by any doctor or hospital that accepts Medicare. So Medicare supplement plans do not have in-network or out-of-network, which is great. You can see any doctor that accepts Medicare. Remember, they do have a monthly premium, and their benefits are standardized by Medicare based on the plan letter. So here's a chart of the current Medicare supplement plan offerings: Plan A, Plan B, Plan C, Plan D, F, G, K, L, M, and N. There are exclusions for some plans. Probably the most popular plans right now are Plans G and Plan N. But just to kind of breeze over this a little bit, Medicare Part A coinsurance and hospital costs, you can see all of them cover this at 100%. Medicare Part B coinsurance, so these plans all cover that 100%. So what does that mean? That means when you go to the doctor, and Medicare pays that 80%. These plans will pay that 20% that is left over and usually falls on your shoulders. So if if the doctor bill is $100, Medicare will pay 80% of that, and then the supplement plan will pay the remaining 20%. And first 3 pints of blood. So if you do need a blood transfusion, Medicare does not cover the first 3 pints of blood. Most of these plans will cover a portion of that, if not all of it. Part A, hospice care. As you can see, they all cover a portion, if not all of it. Skilled nursing facility. Remember, after that first 20 days, there is a coinsurance. The chart below will show you what plans will cover a portion of that coinsurance. Medicare Part A deductible, which is, just a little over $1,700 in 2026. The chart below shows what plans cover what portion of that deductible. Medicare Part B deductible. There are 2 plans that cover the deductible, Plan C and Plan F. Unfortunately, most people aging into Medicare now do not qualify for those plans any longer. Part B excess charges, Plan F and Plan G. Again, Plan F you're not going to qualify for. Plan G would cover that excess charge. Remember that excess charge is 15%, and not all doctors will charge that. Some do. If you have Plan G would cover that excess charge. Then foreign travel emergency. So if you are traveling overseas and you have an emergency, you can see what plans are going to cover a portion of that. So just to recap, Medicare supplement plans, also commonly referred to as Medigap plans. If you get a supplement plan, you will need to purchase a separate drug plan to satisfy the Part D requirement. And Medicare supplement plans do not cover dental, vision, and hearing. So if you wanted coverage for that, you would have to purchase a separate plan for that as well. If your doctor accepts Medicare, then by law, the doctor must accept all Medicare supplement plans from any insurance company. Medicare supplement plans travel well and are widely accepted. So now let's go over Medicare Advantage plans. Like Medicare supplement plans, they are offered by private insurance companies. A private insurance company takes over Part A and Part B, so they do take over your Medicare, your original Medicare, and together it now becomes Medicare Part C. So Medicare Advantage plans do have in-network and out-of-network when referring to healthcare providers, and they may include additional benefits not covered by Medicare, like vision, dental, hearing. Some will give you over-the-counter benefits and things like that. So Medicare Advantage plans are usually either an HMO or PPO. There are some other type of plans out there as well that we can discuss later, but your 2 main types are going to be HMO or PPO. Your HMO does limit you to in-network providers. They usually keep your costs lower, but they do limit who you can see. A PPO, you can go outside of the network, but the provider must accept a PPO plan, and typically your copays are going to be a little bit higher if you go out of network. So typically Medicare Advantage plans have copayments, deductibles, and maximum out-of-pockets or a MOOP. So what is a MOOP? Well, essentially it's a safety net. Once your combined copayments and coinsurance reach this, the plan will pay 100% the rest of the year. Now, it is worth noting that the MOOP does exclude monthly premiums, if any, as well as prescription Part D costs for the plan. So if you're paying copayments for your medication, it's not going to be included in the MOOP. But once you hit your MOOP, whatever the plan sets it at, let's say it's $5,000, $6,000, $7,000. Once you hit that, the plan will pick up the cost at 100% for the remainder of the year. Medicare Advantage does have an enrollment period from October 15th to December 7th. You will see a lot of advertising for Medicare Advantage plans, especially during open enrollment. There's going to be a ton of it out there. You're going to get a lot of mailers. You're going to get a ton of phone calls. So it is good to educate yourself as much as possible and find a local agent that can help you out and answer all of your questions. So Medicare Advantage plans do have costs included within the plan, such as deductibles, co-payments, and coinsurance. You always want to make sure you read through the summary of benefits to see what your benefits are and how much you might have to pay out of pocket for your Medicare Advantage plans. Plans change drastically from carrier to carrier or from plan to plan within that carrier. So you want to make sure for any specific plan you're thinking about signing up for, you want to read the summary benefits for that specific plan. Now, remember earlier we said that Medicare Advantage plans do have networks. So your doctor can either be in network or out of network. So you want to make sure that all your doctors are listed as in network for the plan. Again, PPO plans will give you a little bit more flexibility. So your doctor can be out of network as long as they accept that PPO plan. However, your coinsurance or copays may be slightly higher. Also, just like when we talked about Medicare Part D earlier and your prescription drugs, if you're joining a Medicare Advantage plan that has a prescription drug plan built into it, you want to make sure all your drugs are accepted by that Medicare Advantage plan. And just to start the recap here on Medicare Advantage plans, remember they typically have copayments, deductibles, and a maximum out of pocket, and they do replace your original Medicare Part A and Part B and become Part C, and they are administered through private insurance companies. Just to say it again, remember Medicare Advantage plans have in-network and out-of-network doctors, and you want to ensure all of your doctors and medications are included in your Medicare Advantage plan. All right, so let's compare Medicare supplement plans to Medicare Advantage plans. All right, so let's compare and contrast the two different types of Medicare offerings here, Medicare supplement and Medicare Advantage. So with Medicare supplement, remember, you do have a monthly premium, but very little out-of-pocket expenses. You have the freedom to choose doctors and hospitals, and no referrals are necessary. You do, in most cases, have no additional benefits like dental, vision, and hearing, but you are covered anywhere in the U.S. Medicare is accepted. Now, with Medicare Advantage plans, you generally have a lower monthly plan premium, but you may also have deductibles, co-pays, and coinsurance up to the maximum out of pocket. You are restricted to a network of doctors that accept the plan. You may need referrals for specialists, but the plans typically include additional benefits like dental, vision, hearing, and others. And again, we'll say it, you are going to be restricted to a network of doctors that accept the plan. All right, to continue the differences between Medicare Advantage and Medicare Supplement. With Medicare Supplement, they do not come with drug plans, so in order to avoid the penalty, you would have to purchase a drug plan separately. They do travel very well. They usually have underwriting after the initial enrollment period, so there is a set period of time when you're aging into Medicare where you can get a Medicare Supplement plan as guaranteed issue. Once that expires, in most cases, you would have to pass underwriting to qualify for a Medicare Supplement plan. And you can change plans and insurance companies whenever you want, but you may have to pass underwriting as well. Now, Medicare Advantage. Many Medicare Advantage plans include prescription drug coverage. Some do not. HMOs do not travel well. PPOs travel fairly well. Just call in advance, and remember you may have higher cost shares and copayments. No underwriting for Medicare Advantage plans, and they do have limited enrollment periods. So, when do I enroll in Medicare if I am turning 65? So, your initial enrollment period, also known as IEP, is a 7-month window. It is the 3 months before your 65th birthday, the month of your 65th birthday, and then 3 months after. I always suggest enrolling as soon as you can to avoid any delays. Now, you cannot enroll into a Medicare Part D prescription drug plan or a Medicare Advantage plan until you have your Medicare ID number, which is on your Medicare red, white, and blue card, which will get mailed to you after you sign up for Medicare. So that's another reason why it's important to sign up as early as you can so you can get that card and have that number available. Again, it is important to enroll as soon as you can. I like to always say the first day that you can enroll because it does take 4 to 6 weeks for that Medicare card to arrive in the mail. Now, with Medicare supplement plans, you can enroll into a Medicare supplement up to 6 months prior to your birthday. Again, this is part of that window we talked about where the plan is guaranteed issue and you don't have to pass underwriting. Now, if you are under the age of 65 and you're already on Social Security, then you will automatically be enrolled into Medicare Part A and Part B. If you are not on Social Security, you must actively enroll yourself through Social Security. A few different ways to enroll. The easiest would probably be go to www.ssa.gov or call 1-800-772-1213, or you can contact your local Social Security office to make an appointment, go in and register for Medicare. All right, let's get into some Medicare frequently asked questions. All right, remember earlier we talked about, do you need to actually enroll into Medicare when you turn 65? So here we are going to answer some of those questions. So first, we want to check with your employer and ensure your plan has credible coverage. So if you're planning on working past age 65 and you have health coverage through your employer, as long as it's credible coverage, you may not need to enroll in Medicare Part B. If you have credible coverage, then you do definitely want to enroll into Medicare Part A, especially if it's premium-free Part A. If you have those 40 work credits, get into Part A. You don't have to necessarily enroll into Medicare Part B right away. You can defer Part B until your credible coverage ends. It is important to do a cost analysis of your employer plan versus Medicare. In some cases, Medicare may be a better fit, but certainly not all the time. So make sure you do that cost analysis. See if you're actually going to save money by going on Medicare A and B, or if your employer plan might be a better option for you. If you are currently enrolled in your spouse's medical plan through their employer, you may not need to enroll in Medicare right away. So ensure your spouse has credible coverage through an employer-sponsored plan. Definitely enroll in premium-free Medicare Part A, but you may defer Part B until your spouse's credible coverage ends, typically when they decide to retire. And just like earlier, do a cost analysis of the employer plan versus Medicare. You may not need to enroll in Medicare Part B right away if your spouse's employer plan gives you better coverage at a lower price than Medicare does. So if you're over 65, when should I enroll into Medicare? So assuming you had credible coverage through your employer, then you have an 8-month window to enroll in Part A and Part B starting the day you lose the employer coverage. You can fax or mail your CMS Form 40 Bravo and CML564 to CMS. If you did not have credible coverage, you can enroll January 1st through March 31st each year. Keep in mind you may have a late enrollment penalty that you'll have to be responsible for. So you go to the VA. Do I need Medicare? Well, both Medicare and the VA recommend that you enroll in Parts A and Part B. If you have a VA rating below 50%, you should absolutely enroll into Medicare Part A and Part B. Not only does this give you more options, but it's just a good idea overall. I deal with a lot of vets, and I can't stress enough that having both Medicare Part A and Part B is a good idea. Just in case the VA is not getting it done for you, you have the flexibility and freedom to go get outside help. As I said a little bit earlier, having Medicare allows the VA veteran to get access to care outside of the VA. For example, the VA does not give second opinions of diagnosis. Medicare can help by allowing you to access outside of the VA system. Now, the VA does not accept Medicare Parts A and Part B, but the VA does accept Part C Medicare Advantage plans. Now, veterans have the option to enroll into Medicare Advantage plans as it may provide them more flexibility outside the VA. And remember, Medicare Advantage plans may provide those additional benefits we talked about earlier. I have TRICARE. Do I need Medicare? Well, TRICARE requires you to enroll into Medicare Part A and Part B by age 65 in order to keep TRICARE. Medicare becomes your primary insurance provider, and TRICARE becomes your secondary. When TRICARE becomes your secondary, it acts just like a Medicare supplement plan, and it includes its own prescription drug plan. Now, TRICARE does not include dental, vision, or hearing, and it does not include chiropractic care, so if you wanted coverage for those, you would have to get an outside plan. Now, some veterans with TRICARE may choose to enroll in Medicare Advantage plan with no drug coverage, as these plans may include additional benefits, usually for a specific need or benefit. Now, let's talk about CHAMP VA. Do you need Medicare? Well, CHAMP VA does require you to enroll in Medicare Part A and Part B by age 65 in order to keep CHAMP VA. So Champ VA requires you to submit form VA 10-7959C within a 90-day window before your 65th birthday, or you can lose Champ VA. I cannot stress this enough. Make sure you get that form submitted before your 65th birthday, or you will lose Champ VA. Champ VA requires a copy of your Medicare ID. Once you receive the ID, do not wait to get Medicare ID before you submit that form. Submit the form, and once you get your ID card, you can call Champ VA and give them your Medicare ID number. So once you have Medicare Part A and Part B, Medicare becomes your primary and Champ VA becomes your secondary. Once you are on Medicare, you can no longer use the VA. You do have to use private doctors. Champ VA does not include dental, vision, or hearing. So if you wanted that, you'd have to purchase a separate plan. And Champ VA does not include chiropractic care. And Champ VA does not include any mental health services either. Some people with Champ VA may choose to enroll in a Medicare Advantage plan with no drug coverage, as these plans may include additional benefits, usually for a specific need or benefit. So I have federal employee health benefits. Do I need Medicare? Well, federal employee health benefits does recommend that you sign up for Medicare Parts A and Part B. If you don't get that Part B and you later decide to change to Medicare, then you may have that Part B penalty, and so do your surviving spouses. Just like with TRICARE for Life and Champ VA, some people with federal employee health benefits choose to enroll in Medicare Advantage plan, as these plans may include additional benefits, usually for a specific need or benefit. So how can I save on prescription drug medications? So there's a bunch of different ways. One way is consider applying for Medicare Extra Help. It's a federal program through Medicare that helps reduce the cost of out-of-pocket prescription drug costs. You can typically check your eligibility on the Social Security website and see if you qualify. It doesn't hurt to apply to see if you qualify. If you do qualify, they will reduce your out-of-pocket costs for your prescription drugs. So Medicare Extra Help typically eliminates Part D penalties, Part D deductibles, and caps your drug costs at $5.10 for generics and $12.65 for brand name drugs in 2026. Extra Help is based on your income. Another option for low-income individuals is Medicaid, which is a state-run program, which is built for low-income people, and it can help you pay for your Part A, Part B, and Part D premiums, deductibles, coinsurance, and co-payments. Another option is many states have state pharmaceutical assistance programs, and in some states, all you need to do is be a resident to become a member. There are no income qualifications. It's also a good idea to reach out to your drug companies as well, because a lot of them have their own discount programs that can help you save money if your drug plan isn't getting it done for you. So here's the part where I do some shameless self-promotion, if you will. So why would you want Kevin to help you make a Medicare decision? Well, you probably do have a lot of questions after this presentation. Again, this was kind of just the basics. I'm sure there are a lot of questions that are left unanswered, and I'd love to be able to help you with that. There are no fees for my services. They are absolutely free. We can help ensure that you have the lowest cost option. We show you how to maximize your benefits. We are with you every step of the way. We'll go over that summary of benefits with you, go over all the benefits and what you can expect from your plan. We can help you over the phone or in person. And we get you the same pricing as if you call the insurance company. So by calling the insurance company directly, you're not going to get a better price than if you go through an agent. There's no truth to that. What the insurance company can offer you, I can offer you at the same exact price, as long as I'm appointed with that insurance company. I can also assist with prior authorizations, helping you get any prescription drug exceptions, help you find doctors, dentists, and other providers that you need, and I can help with billing problems. Some other services I also provide are final expense life insurance. At the end of the day, experience matters. I have years and years of experience and have helped literally thousands of people. If you decide to sign up with someone else, then I cannot help you when you have a problem per the rules of the system. I have years of experience again and have literally helped thousands of people. I'd love to be able to help you answer any questions that you might have and help get you started on your Medicare journey with some success. I appreciate you watching this. If you have any questions, again, there'll be links in the description where you can send me an email, info@paradise1insurance.com. My name is Kevin Hyde. Please reach out if you have any questions.